Dementia Researcher with a blog and a rating.
Age at onset in atypical Alzheimer's disease. Why it matters. One of the types of dementia I investigate in my research is posterior cortical atrophy, PCA. PCA is also called the visual variant of Alzheimer's disease, because the syndrome is characterized by early and disabling visual difficulties and most, although not all cases, show underlying Alzheimer's disease pathology. PCA is a young onset dementia, meaning most people with the condition present symptoms before the age of 65, typically in their 50s or early 60s. Age at onset is an important variable to study for dementia researchers because it is known to influence the clinical expression of Alzheimer's disease. However, this important driving factor is currently under-investigated in atypical forms of Alzheimer's disease. In the only study to date looking at the effect of age at onset in PCA, my team and I proved that age at onset also influences the clinical anatomical expression of PCA. The impulse for this study came from the many patients with PCA I saw in clinic. When you spend many hours in clinical practice and see hundreds of patients over months and years, patterns begin to emerge. If you are a clinician, I'm sure you know what I'm talking about. I noticed that my younger patients with PCA seemed to show more focal symptoms at onset than older ones. For instance, those with earlier onset PCA showing well-defined visual difficulties, accompanied by fair preservation of other functions, while those with later onset PCA seemed to show a pattern of visual breakdown less severe in the context of additional diffuse cognitive impairment, vaguely resembling typical Alzheimer's disease. I shared this thought with clinical colleagues to find out whether they had also observed the same and found many nodding heads. How nice and needed is peer validation to his self-insecurities. I wanted to know whether this subjective impression I had held true, so I went on to test my hypothesis. With the help of Dr. Mania Lehmann, an incredible scientist based at the Dementia Research Center at the time, we pulled together an international sample of 98 PCA. We looked at both imaging and clinical data, and we investigated if the neuropsychological and radiological expression of the phenotype varied according to age at onset. Both neuropsychological and neuroimaging data were analyzed using two different approaches to make sure that our results were robust and not biased by a specific type of analysis. So first, we use age at onset as a continuous variable, and second, we also split the sample using the median age, 58 years, as an arbitrary cutoff point. We found that people with earlier onset PCA, those PCA with very young age at onset, showed lower cortical thickness in posterior regions compared to later onset PCA. We also found that later onset PCA showed the opposite pattern, lower thickness in anterior and prefrontal areas, which was in keeping with our hypothesis. When we look at the neuropsychological scores, we did not find age-related differences in visual tests, but we did find them in tests sensitive to parietal dysfunction, like for instance, digit span and calculation. Sensitive to parietal dysfunction associated with the angular gyrus and parieto-occipital sulcus in particular. These were posterior regions where more difference was found between earlier and later PCA in the imaging analysis. Not only that, but running analysis using age at onset as a continuous variable did not yield different results than using age at onset as a dichotomous one, which indicated that our findings were unlikely due to the type of analysis approach. All these results were corrected by global cognitive impairment and disease duration. Why are these results important? They add knowledge that helps to understand a bit more about the heterogeneity of Alzheimer's disease and to formulate hypotheses about the physiopathology of posterior cortical atrophy. For instance, maybe the temporoparietal occipital junction is an area that holds greater pathological burden, for instance, tau protein, in people with early-onset PCA. If that's the case, why? Is it driven by genetic factors? These findings may also contribute to understand better the trajectory of disease. What does age at onset mean for the disease trajectory? Are people with earlier PCA going to deteriorate faster, or perhaps not? Will they lose posterior cortical related abilities sooner than the later onset PCA group? And if that happens, will they compensate better because of a spare anterior cognitive function? Is there a different order of symptoms progression in earlier than later onset PCA then? These are very important questions to tailor rehabilitation, therapy, and support. As you can see, the role of age at onset has important implications for unraveling Alzheimer's disease. I would like to see more research examining this variable in the coming years.
Thank you for listening. Join the Dementia Research bloggers and share your own views.